It's clear that India is leaving nothing to chance. As of now, COVID-19 is not a concern like the way it was earlier in India. But precautions have now increased in view of what's happening in China as more and more reports emerge of an outbreak of COVID in China, which seems to be going out of control. So here's the latest. We already know that 4 cases of the same variant, which is reportedly running through China right now, have been found in India. The Prime Minister held a high-level meeting with the Health Minister, Niti Aayog and all the concerned task force members to chalk out what to do next. At the end of it, pretty much the message has been, let's step up our awareness and let's be on our guard. The Indian Medical Association, meanwhile, has put out an advisory that's not mandatory, it's just their advice that we should be wearing masks in public places, in crowded places, avoid international travel, check out immediately any symptoms which are like COVID-19 and take a precautionary dose or a booster dose, especially for those who are vulnerable to COVID-19, those who are elderly or are immunocompromised in any way. So just the standard fare. But meanwhile, you've also had meetings from various states, Maharashtra, Delhi, Kerala among them, which have now reconstituted and sort of woken up their task forces saying, let's get cracking once again. So a lot of people have been asking, what does this mean for India? Are we at a threat? Are we going to see another bout of COVID-19? As of now, what experts say is that it is very, very, very unlikely. Even as of today, Mansukh Mandavia, the Health Minister, has said in Parliament that we've had an average of 150 odd cases in the last few days per day. So only 150 odd cases. The current number of active cases in the country is not even 3,500. So as of today, it's not a big threat. Will there be a new mutation that travels in? Remains to be seen. What are the precautions we're taking on our part? 2% of all international travelers that come into the country will randomly be tested for COVID. Genome sequencing of any infections that are prevalent will be stepped up so that we can identify if there is a new mutation. So life will continue as always. It should. Nothing great to worry, but it is also a lesson in public policy and how India maybe took the right steps at the right time as opposed to China, which had a zero COVID policy. What has been proven by this entire incident is that the zero COVID policy is a complete failure. It does not work. Sooner or later, you have to let people out of restrictions, and that's when the inevitability of COVID spreading will take place. A large population that has very little herd immunity, like in China, seems like sitting duck right now to a virus that we've all already experienced over the last year of Omicron. So let's hope that the situation stays the same. As of today, there is nothing really to worry about.
If you like this video, then like, share and subscribe to Mirror Now.